Good afternoon, and thank you for the opportunity to speak today. We've heard over the last couple of days that this industry is at a critical crossroads. We know that the demand for home-based healthcare is increasing alongside the ageing population, and some great presentations have really showed the demographics to this group. Our ageing population, it has increased complex care needs. We have a healthcare system that's under pressure, and a growing expectation that care should be delivered where people feel most comfortable, in their homes. So where is the secure future in home care? And how do we, as industry leaders, all ensure that we're investing in the right strategies to make home care not just viable, but a cornerstone of the healthcare system? Today I'm going to share very briefly with you a little bit about what Silverchain is doing in terms of its commitment to comprehensive care at home, expanding into acute care in the home and scaling nationally, and what this means for our investment in technology, in people and culture over the next 5 years. So we all know that traditionally home care has been associated with lower acuity services, help with daily activities, medication reminders, companionship, but we're moving into a new era, one where hospital care in the home, virtual healthcare, and specialist home services will redefine how we think about home care delivery. It's a familiar reality for all of us that our healthcare system is struggling under the weight of the demand, and it's ever increasing with our ageing population. Our healthcare costs continue to rise, and consumers want options that align with their lifestyles and their changing preferences. The only way to meet the demand sustainably is through a more sophisticated home care model that includes both acute and complex care. Silverchain has been on a journey and is committed to a path because we recognise the rise of technology-driven care is a huge enabler. Remote monitoring, we had some great presentations earlier this morning, AI-driven diagnostics and predictive analytics. They enhance safe and effective care at home and also increase access to those who would not necessarily be able to access specialist and complex services. We recognise that cost effectiveness is crucial. Hospital beds are expensive. Governments are looking for scalable and high quality alternatives. And consumer preferences are stronger than generations before. People generally prefer to be cared for in their homes wherever possible. We know this leads to improved client satisfaction, but also has great health outcomes for people if they can remain in their homes. So by embracing acute home care, we're positioning Silverchain not as an alternative to hospitals, but as an essential extension of the acute care system and a key partner in aged care, primary care, and acute care. So I'll give some specific examples of the areas Silverchain is investing in. Artificial intelligence and predictive analytics. So AI will allow us to predict deteriorations before they happen, improving patient safety and reducing hospital admissions. By automating our data analysis, nurses and care teams focus more on the patient interaction and hands-on care rather than administrative tasks, reducing time spent on documentation, scheduling, and compliance through AI-powered tools releases that capacity for our front line so they can focus on the core task of caring. AI-driven scheduling and logistics optimises our workforce and ensures patients receive timely care while also ensuring our clinicians are having a better experience in their workplace. We have global partnerships with medical innovators, and last week we've got to witness an amazing consultation between an actual AI specialist bot and a patient in a real consultation. And what was incredible to me was the amount of empathy that now AI can really provide to patients. And the feedback from the patient was that the connection they felt heard and listened to was more powerful than what they had previously experienced with the clinician. This was a case in America, and Silverchain has partnerships with global organisations around innovation. We're investing in integrated virtual care. So we're expanding our virtual care capabilities to bridge that gap between in-person visits and being able to access 24/7 hour support. So this enables clinicians to provide immediate advice to people, giving reassurance and comforts in the homes of our clients, but also their families, without disrupting workflows of our key specialists or clinicians or frontline that are on the road. So this includes using things like patient monitoring. We've heard a lot about the workforce challenges of the future, and this helps us really leverage skills from our national footprint that we have and apply across many regions. New models of care. So Silverchain has always been a pioneer in developing new models of care, and we've been proactive to make sure that our care models address service gaps in the system in both health and aged care sectors. We're really fortunate at Silverchain to have leading research and innovation function, which Chris mentioned I now lead for Silverchain. I'll share one example of the service model innovations that we've been working on. So with 1 million Australians receiving aged care at home, we have to make sure that we're not just thinking about physical health care or social health care, but it's the entire social model of healthcare. So in 2024, in partnerships with leading universities, we piloted the first of its kind model of care known as MBED. MBED is Enhanced Management of Home-Based Elders with Depression. So MBED aims to improve the detection and treatment of depression and anxiety among older people receiving aged care services at home. Our studies found that 60% of Australians who access aged care services in the home have symptoms of depression and anxiety. Now, this is not something that's really talked about in the models of care, in what service providers offer. So there's a significant gap in the system to identify the issue that people are suffering from 65 years and older, and then also to provide intervention or treatment. So in our pilot, 86% of the clients who participated in our MBED treatment reported a reduction in depressive symptoms, which many noted improved mood, motivation, and overall well-being. And we know how mental health relates to physical health and quality of life, a really important area that's not talked about much in our ageing population. To complement this, we've trained over 1,000 of our staff members, our frontline staff members, our lowest skilled frontline care workforce, to be able to recognise the signs of when their clients need better mental health support, practice some brief early interventions, and then provide referrals to our MBED service. So while technology will revolutionise care, our people are our most important asset. As we move towards higher acuity home care, we have to enable our clinical workforce to reach their full scope of practice. And we really need to position them to be able to thrive in a culture of innovation. We've talked about AI, and a lot of our frontline workforce and even executives are really scared to embrace AI, but innovation is the way of the future if we're going to be able to deliver the healthcare needs to the people who need it most. So technology will allow us to do it. It doesn't replace human touch, it enhances it. AI and automation are the enablers, ensuring that our specialist care teams spend less time on screens and more time with their patients. Some examples of investments to ensure our workforce culture is fit for future and ready for the whole ecosystem shift that is required from changing from the traditional aged care and healthcare system approaches to what we need in the future are things like ensuring that we create the culture that enables innovations to come from the front line. That's where the great ideas come from. It's not from the executives sitting around the boardroom table, it's actually from our frontline people. So an example of that is smart glasses. We've rolled out smart glasses across many of our states at the moment, which is actually a smart glass, which allows the frontline workers to connect to specialist clinicians, palliative care clinicians, wound care specialists. They could be over in WA and SA, and we're delivering services up in Sunshine Coast, to do a thorough assessment where there is a requirement to do some kind of clinical escalation. So this helps our workforce feel supported, like they can engage with all kinds of specialists, respiratory physicians, wound care experts, palliative care experts at a point in time. And also increases access for some of our most marginalised communities who don't have a respiratory physician in their community. So smart glasses is one example of an innovation that came from the front line. Wouldn't it be great if, and has actually been rolled out across our country. To complement this, we're also investing in advancing clinical training, so continuing to upskill nurses to handle more complex conditions. This includes support from our specialists, such as our wound care specialists, our palliative care specialists, and in the chronic disease area, a really important preventative focus. Ensuring we have career pathways for home-based acute care is important to attract top talent. So we've really invested in our career pathway plan. We not only offer career progression opportunities, but we offer our people scholarships and study assistance through our Silverchain Foundation. And this ensures that we're growing a mindset in our people that supports the quest for lifelong learning. The last thing I wanted to touch on today is listening to what matters to our people. So we all do our people surveys and have action plans to improve the culture across our organisations. One thing that we've heard loud and clear from the people who work for Silverchain is they care about the communities in which they work. They care about the environment, they care about people who are marginalised and who don't necessarily have access to care. So our workforce, being frontline, being carers, are motivated by care. They're motivated by giving back. So we worked across our country to develop up a community impact and inclusion strategy. So it's more than a corporate kind of CSR or ESG strategy. It's a strategy that had input from our frontline right through our organisation to ensure that Silverchain was taking on its responsibility to make a difference to those who need the most support. That includes how we support our environmental initiatives, ensuring our carbon footprint is being monitored but also reduced over the next 5 years. It's about how we create a culture of inclusion and belonging for some of our most marginalised groups, culturally and linguistically diverse people, people who live with a disability. It's about how we ensure our models of care meet the needs for First Nations people in remote, regional and metro communities. So investment in this space creates a highly engaged and proud workforce who want to be a part of ensuring that all people have access to the best possible care. Our workforce is the foundation of our success. Without highly engaged, highly skilled professionals, not even the best strategies will succeed. Silverchain's commitment to growing our culture of innovation allows us to continuously adapt to the changing care landscape. And at the core of that is patient-centred decision-making. So every investment that we make, whether it's in technology, workforce or operations, must be guided by the best patient outcomes, and we include our consumers in the decision-making around that. The second thing that we're committed to is partnership, and that's why I guess we're all here today. Collaboration across the sector is a must. No organisation can do this alone. We need strong partnerships across the industry, including hospitals, tech providers, home care providers, retirement living, resi aged care, and consumers to build an integrated and seamless model of care that's going to be fit for the future. And our third pillar is our commitment to evidence-based practice and research. So scaling nationally requires a rigorous commitment to data-driven decision-making, which has to be supported by research and clinical excellence. So in conclusion, we know that the future lies in embracing this complexity, investing in innovation and committing to high-quality acute care at home. We see a sustainable patient-centred future where home care is not an alternative, but a core pillar of the healthcare system. To succeed, we must leverage AI and technology. We must invest in our people and build a culture that thrives on innovation. And only then can we transform our health and aged care industry to be fit for what the future is demanding.
I'm conscious of our time, so we might stand and have a conversation. I was very keen to have a conversation with Tamara because if you look at your background, when we spoke, I said we need 2 bottles of wine to sit down and discuss your background because your career, you qualified as a registered nurse, but you've gone on and done degrees in mental health and what have you. But you injected yourself into a career in some of the most difficult areas of health support, drug and alcohol, remote communities under challenge and so on. So now you're in the area of research and innovation, plus leading the whole east coast of Australia, which is the largest part of Australia. Where do you see the work that Silverchain is going? 2 factors. For all those people that are really in hard areas to support, how quickly is your work going to be making a significant change there? And secondly, several times through your presentation, you talked about the experience of the clinician in the field and the reward they get. Where do you see things in those two areas? Look at the microphone. That's without being aware I was going to ask you these questions.
Yeah, such a long question. So Silverchain does a lot of advocacy in the industry. So we've worked a lot with the Department of Health around the support at home changes. And so I guess the biggest impact we can have, and why I ended up in the aged care sector, is through that systemic advocacy around system change and reform. And so we advocated strongly around the end-of-life pathway, which wasn't really in the support at home thinking initially. And that's because we believe that all people should have access to the highest quality care, especially as they're starting the palliative or end-of-life process. I guess scaling the technology and some of the partnerships that we have really allows us, and with partners in the room and different providers, to access some of those really regional and remote locations. So, in my career, I have built residential aged care facilities in some of the most remote places in Australia. I mean, not physically build them. I'm a nurse, I'm not a builder. I'm not an architect either. But I did sit down with communities and learn about what is important to people at that large stage of life. And so some of the projects were like up in East Arnhem Land or Central Australia or in the Torres Strait. And there is one thing that rings true to me, and why I am so passionate about influencing the aged care system, is that all people, no matter their background, they just want to be able to have strong relationships with people they trust. And so if we can build trust with our consumers, our partners, communities, through using technology, we're going to be able to increase access to healthcare in a transformational way. But it starts at that relationship level. Sorry, I might have gone on a tangent, Chris. And the other one was about our people.
Yep. Well, firstly, your commitment to it is because you've been in the field, and secondly, the benefit for the clinician, that they get a good result. And especially when you mentioned that the bot got a better emotional response than dealing with a human being.
Yeah, absolutely. This bot was actually able to, the person said, I had a really bad day. It's the anniversary of my daughter passing away. The bot was actually able to say, I'm really sorry, can you tell me more about your daughter? And this was a respiratory physician bot that was trained to talk to the individual about the weather conditions, to ensure that it was an asthmatic, to ensure that they were taking proactive steps to manage their exacerbation of asthma. And so it was absolutely mind-blowing to see the potential, what can be done. And actually, let's not just say older people don't embrace technology. Studies have found that's not the case, especially with the shift that we had from COVID. There is a big appetite with the ageing population to embrace technology, and we should really honour their capability to do that.
So with the 2.9 million people who've had an interaction, a virtual interaction with Silverchain, what do you think that'll be in 12 months' time, given this acceptance?
Well, that's too hard a question to ask, Chris. If it's
the acceptance is obviously rapid, isn't it? So
absolutely rapid. It would be my hope that we would be able to double that in the next 12 months. But I'm always very aspirational in terms of what I think is achievable. So even if we could get a quarter way there to doubling it, I think that would make a huge impact.
And the final message, you had a slide up which showed all the different elements, all the different silos, as we've been calling them, of the health system that you are crossing. So it's no longer a matter of home care is this. You would be across 7 silos, but you're doing that seamlessly as long as you can establish the partnerships. Is that correct?
The partnerships and further investment in the interoperability around systems is critical to that. And so we haven't solved that. And I don't think anyone's solved that. It's such a huge challenge. And that's what we really need to get the smartest minds around the table, and government and regulators to solve that interoperability challenge, because that's one of the biggest barriers to that seamless healthcare experience.
Okay, well, thank you very much. Can we show our appreciation? Thank you, Cameron.